Right, I'm here with Hayley Coleman-Phillips, who is the clinical lead for tissue viability at Basingstoke Hospital. And I didn't know anything about tissue viability until about an hour ago. So do you want to just tell us briefly what your team and your department
Okay,
do?
so tissue viability is a specialist service that gives advice and support around any aspect of wound care, from anybody that comes in through the front door with a pre-existing wound, or somebody that would develop a wound or skin tear or injury to their skin whilst in the hospital. So my team cover a 7-day service in Basingstoke, Winchester and Andover.
And so the machine that you're bidding for, you're looking for 4 of them.
Yeah.
The tissue viability SEM scanner, what exactly does that do?
So a SEM scanner is able to pick up damage to the skin before you can see it by eye. So if you've got somebody that's maybe come in with a long line, you know they probably have damage to there, but we tend to have to wait to be reactive to them until they start to break down with a deep tissue injury or even an open wound. The scanner allows us to be able to see in the tissue whether there's any damage when they come in through the front door, so we can put action into place and be proactive with it and try and prevent it. We already know that if we can catch things early enough, we can actually probably reverse the damage before it gets to that chronic stage. So having this SEM scanner would allow us to do that.
And why, I mean, the question that I would ask is, how come you don't have SEM scanners already? Because that just seems like such a vital, obvious piece of kit.
A new thing that's only just got nice guidance and nice backing for it, so
Okay.
It's something that's slowly starting to roll out. It's not an emergency piece of equipment, so it's really difficult to try and get something that's new that isn't everywhere at the moment. There's a lot of backing, like I said, with the nice guidance to show that this works, and this has reduced pressure ulcers obtained within hospital and also reversing the damage when people come in with an existing condition. So it's something that we would love to have.
And does that mean that your turnaround time for patients, you know, coming into hospital and leaving would be sort of speeded up, and therefore you know
A
you'd
little
be able
bit.
to...
So with somebody that has a wound or obtains a wound, their hospital stay can be longer because of complications with the wound or just bed management of that. So it could mean that they don't have such a long stay within the hospital. It's cheaper for the hospital because treatment is 2.5 times more costly than it is for the prevention. So if we can act quickly before it gets to that point of breaking down, then we can actually put that treatment in place and make sure we're putting in the right actions and recognising these patients at high risk, which maybe they wouldn't present as any other way. So yeah.
And what, I mean, like, how many patients do you guys, you know, do you think would you be dealing with on a daily basis with your using the scanners, or you know?
So the thought of having 4 would that they would be at the rep base when they come into the emergency departments, and then 1 in the AAUs in McGill, in Basingstoke and Winchester. So anybody that comes in on an ambulance on a trolley, they would be assessed to see if they've got pre-existing damage, so we can put the care in place from the front door, rather than waiting until they've broken down 2 or 3 days later and now have a bed sore, which is going to take a lot longer to treat.
And this equipment will be used in all 3 hospitals in
So it wouldn't be
Trust,
in Andover because that's the reablement and
Okay.
rehab unit. So it would be more in Basingstoke and Winchester where we could have the emergency patients coming in, so we can treat those that are coming in straight away.
What happens to, you know, if you have a sort of a problem in Andover that needs...
It's a mobile
Scan
device, so we could take it over there.
Okay.
We would unlikely to have somebody admitted straight away to Kingfisher or something like that from a fall. They would tend to go through the pathway of going through the hospital first, and that's where we would catch them. But being mobile, we could take it to where it was needed.
Okay. So we've got, obviously we're creating campaigns around each piece of equipment. You know, what's the kind of key message that you want to say? You know, if we raise £23,000, we'll buy 4 of these pieces of equipment. What's kind of the key message for donors to, you know, why they should help you buy this?
I think nobody wants to come into hospital and obtain any damage. We don't want to harm patients. We want to do the best that we can from the earliest point. So if we can recognise this damage before we can visually see it, then we can put them on a better care journey throughout the hospital, which not only improves their state but reduces their level of harm that they can obtain.
Awesome. Well, look, this campaign is to try and buy the SEM scanner.
Yep.
We want to try and buy 4 of them for the tissue viability unit, and so there's a donate button attached to this campaign. If you are convinced and you want to put some money directly into this department, then you just have to click the donate button. All the money will come straight to Hayley and her team. So click the donate button.